Well, good morning, everyone, and I hope you can hear me now. I gather that all you saw was moving lips and got a lot of silence before. But look, it's a pleasure to join you this morning. My name is Maxine McHugh. I'm a member of the Library Board of Victoria and chair of the Advisory Committee for Public Libraries. And it's wonderful to welcome you to this seminar online, Small Libraries, Big Impact. We're conscious that we've got people joining us today from right across the state, which is fantastic, and particularly from people in rural and regional area. Of course, those libraries contribute so much by providing places, programs and connection. We've got a great lineup of speakers this morning, so let's begin. I want first of all to acknowledge that the State Library acknowledges the traditional lands of all the Victorian Aboriginal clans and their cultural practices and knowledge systems. We recognise that our collections hold traditional cultural knowledge belonging to Indigenous communities in Victoria and around the country. We support communities to protect the integrity of this information gathered from their ancestors in the colonial period. We pay our respects to those elders, past and present, who've handed down these systems of practice. Now, just a little bit of housekeeping before we begin. If you've got any technical issues, I had the first one. We ask that you please refresh your browser and press play to restart the stream. We love to hear your voice, so please use the chat function. And if you have any other questions for our speakers this morning, post them in the questions box underneath the video. Now, this morning we are joined by some people who know exactly how important regional and rural libraries are to their communities. First up is going to be the Honourable Melissa Horne, the Minister for Local Government. We'll hear from her very shortly. Then from Leanne Williams, the CEO of My Community Library and, of course, President of the Public Libraries Victoria Executive Committee. Also joining us will be Dr. Rebecca McGowan from Indigo Shire, and you're really going to want to pay attention to her presentation. She's going to be telling us about the important work that's being done in delivering healthcare services and the way that libraries can help this. Then after a short break, we'll be back for some real-life examples of the impact that funding makes. We'll catch up with Paul Duldig, the CEO of State Library, before hearing from Dr. Angela Savage, who's going to lead us in a panel discussion about the delivery process and outcomes for libraries who've received innovation grants. Well, let's go now to our first speaker. All libraries need a terrific champion up there in Spring Street, and we've certainly got one with the Honourable Melissa Horne, State Minister for Local Government. She was, of course, at the recent Public Libraries Conference, opening that event, and is clearly a great advocate for our sector. Melissa Horne, you're very welcome.
Well, thank you very much. It's great to be with you virtually today to talk about the importance of libraries that have in our lives. Now, I've been asked to say what aspects do I appreciate most about public libraries. And I think what's important to say is that I grew up in a small country town in New South Wales, where my access to knowledge was through my school and my public library. And having that access of knowledge through a small regional library was absolutely vital to so many people in my local community. And this is one of the key things that I think there is, that equity that public libraries provide, being able to give that knowledge regardless of who you are, where you come from and what your background is. So that's one of the things that I really appreciate about public libraries. Of course, public libraries do a whole heap of different services across the community, and never have we seen this so prominently as what we saw during the global pandemic, where libraries really stepped up and provided that access to knowledge and that support across communities that were so isolated. And when you had librarians going there and packing books and sending them out and making sure that people had that access was so important. Then when people came back into libraries, they certainly came back in force, because they are, I think, at the heart of it, places of refuge. They offer support they offer safe places. They offer access to other people and those sorts of connectivity that people really value and we have not seen and people really missed during the global pandemic. So it's those sorts of social cohesive things that libraries really offer. What the government is doing to make sure that libraries remain inclusive spaces and they cater to underrepresented populations, and these includes individuals with disabilities, migrants and rainbow families, is that we've been really clear that equality in Victoria is not negotiable. And that's why we've looked to libraries to be that safe place, that safe and inclusive place that we have really come to value as part of those core things over the course of, since libraries have really been in existence. So it's good to be able to go out there, and I appreciate that librarians have gone through some tough times lately. We've certainly seen the rise in the far right groups that have targeted librarians significantly unfairly to be able, and that's why it's been really important to me to go out there and to talk to librarians, to understand their stories, but also too to say that this is a state government that supports you. We value what you do, and we want to be able to say, you play a really important role in our community. So really, from me, thank you very much for everything that you do, particularly, as I said, in regional and rural communities where that access to knowledge, where those accesses to services may not be as prevalent as they are in bigger metropolitan areas. And having grown up in a small country town, I truly value everything that you do. So thank you very much.
Thanks so much, Minister. Good to get that very supportive statement from you. And I note very much, as you said, equality is not negotiable. A very important thing to keep in mind. So thanks very much for your attendance here this morning. Well, next up, we're going to hear from Leanne Williams, the CEO of My Lead and President of Public Libraries Victoria Executive Committee. Leanne is going to show us how important libraries are to their communities, especially regional and rural communities who have complex needs and limited resources.
Thank you, Maxine. I would also like to thank Minister Horn for her support and recognition of the vital role our libraries play in our communities. First Nations people are this land's first storytellers, and last week I attended the Bass Coast South Gippsland Reconciliation Group Sorry Day event. I heard stories from Aboriginal and Torres Strait Islander people of their lived experience and trauma of the stolen generation. Patrice Mahoney, OAM, encouraged all of us in attendance to recognise the discomfort that hearing these stories brings and the importance of educating ourselves to support Aboriginal and Torres Strait Islander people. They can't do all the heavy lifting. This speaks to the theme of Reconciliation Week. Be a voice for generations to encourage all Australians to be a voice for reconciliation in tangible ways in our everyday lives. Public libraries are a place where people come to seek out trusted source of information. Our respect and support for First Nations people and the ability to provide a safe and welcoming place in public libraries is more important than ever. I would like to acknowledge the traditional owners of the lands on which we are all meeting today and pay my respects to elders past, present and future. On any given day, anywhere in Victoria, there are over 60,000 people visiting one of our 281 public libraries. To give context to the demand of our public library services, here are a couple of fun facts. 1 in 3 people are a member of their public library in Victoria. There are more public libraries in Victoria than there are McDonald's restaurants, and more people are members of public libraries than members of the AFL and NRL combined. This speaks volumes to how much our communities value the services we provide. Our range of services and programs are an essential service for all ages, genders and interests. Our role is particularly vital in regional and rural areas, sometimes hundreds of kilometres away from other towns or services. So often the local library is in the heart of our communities, offering services residents can't access elsewhere. In our Libraries Change Lives campaign, we have always highlighted the strengths of the sector, its people, and the communities we serve. But we also have a responsibility to highlight the challenges faced by libraries as they struggle to maintain program levels and replenish collections of books and resources. In the recent campaign, Protect Public Libraries, I heard many stories from our communities highlighting just how essential our services are. I will share with you a few now, as hearing from our communities in their words has a bigger impact. I'm a single mum of 2 young children. The libraries I use have been a safe and low-cost space for me to use on rainy days with my children. We have had so many good times, and my eldest son, who is now 6, is in the top of his class for reading. Every night I read books to my kids that we have borrowed from our local library, and these spaces are so valuable to the community and provide the building block for many in having a healthy life and family. And here's another. I'm disabled and live in a regional village with few facilities. I rely on library books and DVDs to be dropped and collected from my local collection point. I call on the state government to support free, safe and welcoming spaces for communities weathering a cost of living crisis by protecting and increasing investment in our precious public libraries. And another, I rely on my library for literacy support in access to content, family support with young children, events and services, and as a social location that is accessible and free. Where misinformation is rife, we need places where there is information experts to assist people in information literacy. In this current economic climate, there is no way I could afford the books, media or services that libraries offer. The public library offers my child and many children in our area a space where they can get opportunities to foster a lifelong love of learning. Supporting libraries will support the wider community. These stories highlight that our public libraries are a place where people come to learn, connect, and feel safe and supported. They are a refuge where people come to stay warm in winter and cool in summer when they can't afford to run their own utilities. Families who can't afford their home internet, so instead go to their libraries for free access to computers, internet and Wi-Fi. In Mildura and the Golden Valley, the library is the only place that 15% of library users can access the internet. In Wodonga and Warrnambool, 11% of users can only get online by visiting their library. And with cost of living pressures at a decade-level high, some of the most valuable members of our community rely on libraries for basic services. As the cost of living increases, it's no surprise that the cost to run our libraries is increasing too. Driven by high inflation that's being felt across all sectors, some libraries have had no choice but to cut back unless they receive significant increases in funding. A survey conducted in October last year found that 35% of libraries were buying fewer books, 55% had cut programs, and 1 in 3 had cut staffing levels as funding pressures hit. Libraries are being asked to welcome more people through their doors, deliver more programs, and make more resources available while only receiving nominal or no increases in funding that don't keep pace with the cost of hikes. We all know the needs of public libraries are changing, and library staff are on the front line trying to support people who are distressed and desperate and sometimes unwell. In regional Victoria, libraries are a lifeline for people living in rural and isolated communities. We hear every day from people who say their local library is their primary connection to the outside world. With 40% of regional library users aged over 70, we cannot emphasise enough the value of connection for older residents who may face loneliness and isolation in their daily lives. Essential, connection, safe, community. These themes appear again and again and are a clear reflection of the role libraries play in people's lives. This is why decisions such as the suspension of the interlibrary loans late last year were so difficult to make. Public libraries had no choice after changes to the Victorian government's state purchasing contract saw courier costs increase between 300 and 720%. Understandably, this was devastating for regional Victorians who rely heavily on the service to access any book they want to read or study, even if their local library doesn't have that book on the shelf. While we've negotiated a temporary reprieve in the form of a pilot courier program with Australia Post, costs are still higher and there are still restrictions in place. Interlibrary loans are the key to equity of access, with more than 500,000 collection items shared around the state each year. But without additional funding to maintain the program, our smallest and most remote libraries will be limited to what's held at their local library, and called communities won't have guaranteed access to material in languages other than English, held in various public library collections around the state. We can look to the Victorian Government's Living Libraries Infrastructure Program as an example of governments working together to provide the best outcomes for regional communities. The program matched funding with local councils to support the construction of new libraries and the redevelopment of existing libraries. It has delivered some amazing library buildings in many parts of regional Victoria, with a current investment level of $4 million per annum. But with the construction costs up by almost a third, we can't maintain the current level of construction without more funding. Continuing to increase the funding in Living Libraries Infrastructure Program will enable the upgrade of more library facilities, deliver new libraries in growing communities, and improve accessibility to existing libraries, provide mobile library services in remote areas, and fund digital infrastructure. Digital infrastructure is critical for a modern library, and Infrastructure Victoria recommended that regional and rural libraries have an important role to play in helping bridge the digital divide, which is more than twice that of the state average in some areas. Investment in public libraries ensures every library and every community has equity of access. When we invest in our libraries, we all benefit from the positive impact that they have on people's lives. Over 60% of library users say it is very important to their mental health and wellbeing. 72% say they feel better at the library, and 59% feel connected to other people. And 41% say their library is very important to their physical health and wellbeing. Overwhelming benefits like this reduce reliance on other support services and are literally a lifeline in our communities. That is why our Libraries Change Lives campaign is so important, to continue our work and offer those safe places and connections and services that benefit us all. Thank you.
And thank you, Leanne, for the context you've given there, and certainly those statistics, because they're pretty sobering, aren't they? We know as funding does get a bit tighter, all of the good work that libraries achieve, it's so important to sort of get the message out about there. What strikes me, of course, as I do the odd regional tour around libraries, as we did recently, is that libraries these days are really at the centre of tracking and responding to social change, which brings us really to our next guest. Someone who is very familiar with the health and wellbeing needs of rural and regional Victoria, and that is Dr. Rebecca McGowan, a local GP, a business leader, and an advocate for public libraries. She's most recently been a part of the documentary Bushfire Babies from Bloomberg Investigates, and that explores some of the tragic long-term health impacts that are starting to emerge since the Black Summer fires of a few years ago. Now, Dr. McGowan is here today with us to talk about the struggles that rural communities face in delivering positive health outcomes for their people, and we'll have a bit of a chat at the end of her presentation. Dr. Rebecca McGowan, good to have you with us.
Good morning, everyone, and I would like to thank Libraries Victoria for hosting this event. I'm coming to you from Doodawarra land here in northeast Victoria. I'm born and bred a local woman, and I've come back to be a GP in my community. What I see with rural health at the moment is a system in crisis. Rural health is broken and it's getting worse. The system needs to change. What we know is that on all health parameters, according to the Australian Institute of Health and Welfare, rural people are doing worse. Higher rates of death and higher rates of poor health. We know that rural and regional Australians make up 28% of the population. It's vital for our community that we turn these statistics around. The health system, as I said, is broken. When I did medicine in the 80s, 60% of all medical students went on to do general practice. Now it's 13%. Also, we know that up to 50% of all GPs will be retiring in the next 10 years. We know that there's high costs to see a doctor, a GP or a specialist. There's long waits. The hospital system is overrun and EDs are blocked. Emergency departments, it can take 8 to 10 hours for a person to be seen. The system, unfortunately, is reactive rather than proactive. However, there are solutions. And one of the solutions is for rural people to become more focused on prevention and less focused on crisis points. So what that means is that people start to bring preventative health into their life. We know that up to 50% of people have a chronic disease. That's the bad news. But the good news is that up to 80% of factors causing chronic disease are preventable. The thing that we're looking for is how to bring prevention into people's lives. And that's where these preventative health programs come into being. And that's why it's really important that preventative health programs are able to be rolled out across rural Victoria. I'm very grateful that the Victorian libraries were able to give us a grant here in the Indigo Shire so that we could bring one of our preventative health programs from my business LifeVest to the libraries of Yakandanda and Rutherglen. So last year, in the middle of winter, we ran 10 programs that were really well attended. So 2 programs for women and 4 programs each for men in Yakandanda and in Rutherglen. And even when the temperature got down to -4 degrees on some nights, we were still well attended. So the programs focused on physical health, mental health, and social connection. Social connection was really important, particularly post-COVID and in the middle of winter. So we talked a lot about how to bring prevention into people's lives. The topics covered everything from heart disease, diabetes, cholesterol, how to interact with the medical system, and how to be a boss when you walk into your GP. Really good techniques. And as a GP, I was able to give that insider knowledge to the group, and also covered things such as mental health, anxiety, depression, suicide. And we covered topics such as advanced care directives. So they were really holistic programs and really well taken up. The demand was huge and the impact was incredible. So this thing of libraries change lives, I would say libraries change lives for the better. And we certainly have seen that in our community. A year later, I still get people crossing the street when I walk down the main street of Yakandanda. People cross over to talk to me and proudly pull their belt notches out and show me their bellies and tell me how much weight they've lost. I have wives coming up to me, and sometimes they're a little bit annoyed because they say, I've been telling him all these years to cut back on his alcohol and do exercise, and he does your program and now he's doing it. They are pleased, but I frequently get people saying, when are we going to do more? We need to do more. We need to get prevention out there into the communities. The costs are minimal compared to what we're going to save. We know that by bringing prevention in and working on those 80% of reasons behind chronic disease, we know that we are going to save lives. We know that we are going to improve the health for rural people. We know that we're going to reduce costs for the government, and we are also going to improve the health and well-being for rural communities. So I am grateful that we were able to get this funding. It was fantastic. We have proven even a year down the track that we were able to instigate behavioural change. We have proven that we were able to change lives for the better. We know there is a big need. There is a big need for our culturally and linguistically diverse communities. There's big needs, for example, for our queer community. In Wodonga, we have a large Bhutanese community and a large African community, and also for our First Nations people. So it would be amazing, wonderful, and vital even if we could roll out some of these health prevention, health promotion programs across our area and across regional Victoria. And we know that the small amount of costs that will be involved will reap rewards in the end. So I am imploring the Victorian government to support libraries to bring out these health promotion programs. Libraries are superbly placed to do this. The best part of these talks really was the last 10 minutes when we could bring out the books. And I love talking about books. I recommend books every day to my patients. So the Victorian Library has a big amount of health books, as you probably know. Indigo Shire was very capable and able to bring in most of the 20 books that I'd recommended. Lauren from Indigo Shire still has the list, so if you're interested, go and look at them. Everything from heart disease to gut to advanced care directives, meditation, and so at the end of these sessions, we'd bring out the 10 books or so on that topic and talk about it. And it really did achieve the objective of helping people reconnect with the library. So many of the men said that they hadn't been in a library for decades, and they came in and they read the books and they shared that knowledge around. So big library, small libraries, big impact. And we can say that this program definitely changed lives. We know that a year later, there's a demand for it to keep going. And we know that the costs involved to roll out these programs will benefit the Victorian government in the long run, but most importantly, benefit our rural communities. So thank you to Libraries Victoria for inviting me and my business Life Vest along. And I hope that we can have more of these health promotion programs rolling out across Victoria. Thank you very much, everyone.
Rebecca, thank you for that. We've got a couple of minutes just to have a bit of a chat here. And it's so good to hear you praising the work that libraries have done in helping you with those programs. And by the sound of it, getting people into the libraries, like perhaps some older men who've, not been users of libraries, coming in and getting those messages. So good to hear about those solutions. Can I just take you back, though, for a bit wider context? What you said right at the beginning, that we're dealing with a broken system. What's happened, say, in a state like Victoria, which to me looks, it's not a vast state like Queensland or Western Australia with the vast distances. It's a pretty hooked up state. What else has been going on that's led us to this situation?
Well, in my over 3 decades of being a doctor, I have seen the health of my rural community deteriorate. There are long waiting times to see specialists, up to 18 months in our local area to see a lung respiratory specialist. And it just means that so many of our rural community, they either need to wait, and 18 months, that's horrendous, or they need to travel down to Melbourne, up and down for the one day, or they need to stay overnight, increase costs, take a day off work or get someone to take them. It's appalling, and it is getting worse. So I'm not sure whether or not people who live in urban areas really understand the extent of deterioration of the medical services. The main problem I see is that it is more a reactive system rather than a proactive system. So it is literally where the ambulance is coming to the bottom of the cliff, We're not looking at the problems behind. And even when an ambulance comes, it takes 2 hours. So it's a situation that's bad. It's getting worse, but we do have solutions and we do know how to turn it around. We need to, one, acknowledge, and we need to have the courage to move forward and be brave in bringing new solutions to the current health crisis in rural areas.
Yeah. Rebecca, you mentioned this important message about prevention. If we could, switch the focus there, and you mentioned clearly you're getting messages out about better nutrition, weight control, limiting alcohol abuse, alcohol use, I should say. What other things have you tended to look at in your information sessions and helped through the library grants?
Great question, Maxine. So we talk about empowering people, improving health literacy, and also getting people to have their own tools so they can understand when they walk into a doctor's room. So, for example, cardiovascular health. We know that that's still the #1 cause of death and disability. So in our talks, we teach people the tools, how to understand what blood pressure is and what good looks like, what bad looks like. We teach people how to interact with their GP, how to understand what cholesterol is, what it does, sugar diabetes, but with a strong focus on nutrition, including things such as winding down the alcohol, the sugar, ultra-processed foods. We talk a lot about exercise. We talk a lot about sleep and about mental health. So it's the fundamental things behind prevention. Lots of people know, but the beauty of a prevention-focused program is helping people change even 1%. We know 1% changes make a big difference. It's not an all or nothing. So for our rural community, giving them the tools on a daily basis to bring good habits in, and it works.
I imagine, Rebecca, that the majority of the people who came to your sessions would have been, say, over 55, over 65. How do we get to young people this message about prevention and how they should live healthy, productive lives?
Great question too, Maxine. We know that over the age of 50, up to 90% of people have at least one risk factor for cardiovascular disease. So it's really important. Lots of the programs I've delivered have deliberately targeted people under the age of 50. So there can be 2 separate programs, under the age of 50 and over the age of 50. Actually, in some of these library programs, we had people in their 20s and they were really interested in it. And they know that if they get into good habits in their 20s and 30s, that can act like a health superannuation and give them good health for the rest of their lives. So libraries are perfectly placed because it is a safe place for people. And I really believe that we can get these prevention-focused programs out into the community, focusing on young people under the age of 50 and really changing their lives for the better. It is doable.
Yeah, absolutely. And just finally, Rebecca, you mentioned a range of books that people are swooping on, let's hope. Are there one or two in particular? I mean, is there a sort of a top of the pops book about, how to get on top of sugar or whatever it is, or reading labeling correctly in supermarkets? What would you suggest?
Oh, look, there was 2 that were really popular. One is by an Australian physician called Charlie Cork. He's a intensive care specialist from Adelaide, and he's written this fantastic book called Letting Go. And I really highly recommend it to everyone. It's about the Australian health system, and it's about being in charge of your health, of the 100% health event that's going to happen to all of us, which is death. And I really encourage everyone over the age of 25, which I know is confronting for a lot of people, but I encourage everyone to read that book. It's on high rotation in my general practice. So that's one of the ones. The second one that I really encourage people to get, it's called 10 Mindful Minutes, and it's by actor Goldie Hawn, who we all know. And she has developed this fantastic program on mindfulness, which is 10 minutes a day, that she's rolled out across America and parts of Europe from for 4-year-olds and onwards, teaching them about how the brain works and teaching them about 10 minutes of mindful meditation a day. And that is one of the most popular books, not just for people who are parents, but for everyone. Fantastic book, 10 Mindful Minutes by Goldie Hawn.
They're great tips. Okay, letting go and 10 mindful minutes. I'm sure we've got good stocks of those. I'm hoping across our libraries in Victoria. Rebecca, that was very revealing. Look, I thank you for that, for all your work and for making this important link. We've felt certainly in a lot of our strategy documents and all of our goal setting over the last couple of years that, as I say, libraries can be the heart and soul of their communities, which they have been for many years, but also increasingly help communities with their social health. And you've helped, I think, highlight today exactly how we can do that. So thanks so much for your involvement.
Thank you, Maxine. Thank you.
Okay, we're going to take a little break now, 10-minute break. Go and get some water, get some coffee, whatever. And we'll be back, and we're going to then hear from Paul Duldig and Angela Savage. So we'll see you in about 10 minutes.
One of the benefits of working with libraries is they know their communities really well. So in our case, Melton City Libraries helped connect us to the residents who we wanted to be participants. They gave us heaps of advice about how we could design our program to be suitable, but they also connected us to local industry networks and brought them in as guest speakers to make sure that our program is relevant and interesting to our audience.
One of the key things that have made the partnership between Western Base and the library such a success is that we're both very focused on delivering tangible outcomes. So in all of our programs, we've seen people return again and again.
It's an opportunity for kids with a real passion for STEM to foster their creative and science, technology, engineering and math passions in a place that they can work together and collaborate with each other.
Partnerships are a really great way to increase accessibility and inclusion within the community. In our case, the Your Career, Your Way program is really focused on empowering women to take charge of their career pathways, build their networks and grow their confidence.
Canine Comprehension brings dogs into schools and homes and libraries and helps make the connection between our learning and our communities stronger.
Chatty Cafe is a health promotion and a harm reduction charity focused on reducing social isolation and loneliness in the community by having people have safe, respectful, friendly conversations. Public libraries are very comfortable, safe, respected environments. They're community hubs in their own right, and Chat is all about community. The Bayside Council and library support has been wonderful. It has been key to Chatty Cafe reaching out across communities now across Australia.
If you were considering partnering with the library, the advice that I would give you is definitely reach out to the library, talk to them about what you think the community needs are and what you can certainly offer. And in such a wonderful environment with great resources, it's a win-win for everybody.
It is what we are about as libraries. We are about making a difference with people. We are about a love of reading and a love of learning. And it's been a roaring success.
We laugh, we learn, and we have lots of fun. We always say it's far more nattering than knitting.
Since the program started, most of it have got to be really good friends, and we look out for each other. People said, if I hadn't joined a group like this, I don't think I'd have stayed sane. And you didn't realise the impact the communication and the socialising meant to them. I enjoy bringing people and I enjoy knitting. I'm not a good knitter, but I enjoy knitting.
COVID was terrible. You know, you'd wake up Tuesday morning and think, oh, what am I going to do? It's knit and natter. You know, it's time to go out and have a coffee and laugh and, you know, maybe do some work. It was really great when it started up again. We really did miss it.
We're social beings at heart, really.
They have a Scrabble afternoon. There's lots and lots of things that you can do at our local library.
just a wonderful place to come to play Scrabble.
Most of us live alone and company is good.
I think it's a great afternoon to challenge your mind, to learn new words and to enjoy the company of other people. We try to get a good score, but it's not in an atmosphere where you feel threatened.
The Rhyme Time session is a fantastic opportunity for parents to get out of the house and to engage with other parents. I think that would be really positive on the well-being of parents in Swan Hill.
I brought my baby last week and I found that he's really enjoying by coming up here. So I decided myself to come every week and spend some time here. I really recommend either moms or dads, okay, or even grandpas. They can bring their kids here. The babies will enjoy.
Yeah, we really enjoy coming to sing different songs and learn different rhymes. The babies definitely sing better than the parents.
It's been amazing to be able to connect to other parents and other families that we just haven't been able to while in quarantine. Yeah, it's been great.
And it just instills a great love of books and helps with their early literacy learning as well.
Just how inviting it is. It's a really relaxing environment and lots of fun.
Really enjoys all the songs and the stories and yeah, getting to do a bit of craft at the end as well.
Mm-hmm.
Yeah.
I was just seeing my friend.
Some of them said my mental state was just at that stage where I had to do something, and this has really saved me. And it's little things. I mean, it's just getting together for a couple of hours a week means a lot to some people. A lot more, I think, when you're alone too.
Yeah, it helps me relax and just enjoy my time with my kids rather than just get, mad and angry. Yeah, it's good.
Something the wider community may not know, perhaps that it is free and it's every week. It is just such a welcoming, friendly environment. Yeah, it doesn't matter what you look like or anything like that, you just come along and join in.
If you're feeling a little bit down, you come here and you honestly would forget about whatever the problem was, or you can share a problem. So it's just a very relaxing time. So it really is very good for your mental health. And the staff are brilliant, really very accommodating.
Make us all welcome every time we come. It's always a pleasant atmosphere to be in.
They put up with an awful lot of noise on Tuesdays, but I think it makes the library more human. It really does, yeah.
I love the library.
More than $17.5 million is spent on Mildura poker machines each year. As a Victorian Responsible Gambling Foundation funded program, Libraries After Dark is offering an alternative for gamblers by creating a community lounge. Libraries After Dark has allowed us to bring guest speakers into the library, run arts and crafts events, and even help connect people to job opportunities.
Libraries are the heart of our communities. They are a place to connect, to bring your family, to work and to escape. I think it's fantastic that the library in such a central location is open for longer because it gives an alternative to people who maybe have a problem with gambling, and now they can go somewhere that's so creative, inspiring, but also safe and quiet and centrally located in Mildura.
Mildura was the 17th library service to join the Libraries After Dark program in July 2021. One of the really rewarding things to see is when two strangers come in to participate in a craft activity or watch a movie, and they form a bond and they stay and have a chat, and we see them come back next week and they continue that friendship. It's giving people a really great opportunity to connect with others.
The Gorman Award, it's about inclusion and accessibility. So
As librarians and library staff, you work with your community day in, day out, including people with disabilities, understanding what their needs are, understanding what gaps and inaccessible areas may exist in your library. So you can use the funds to close and bridge those gaps to make the library environment a safe, welcoming and supportive environment for all.
Only 5% of printed materials sitting on the Australian bookshelves are currently accessible to the community of people with print disability. I guess for any sort of reason that person cannot hold or see a book, they are having print disability. It has a profound impact on one's life. It's very difficult to find education, therefore employment, therefore being independent and socially included.
I had a conversation with an NDIS provider who asked what programs we specifically offered adults with learning disabilities, and embarrassingly, out of the 70 programs we had on offer, none were suitable. So I did some research and found that Campaspe Libraries were offering the Next Chapter Book Club program. I applied for the Pierre Gorman Award to be able to bring that program to Melton City Libraries. And now we have a regular program for adults with learning disabilities. They come together, share a book, hang out and have fun.
In 2022, Brimbank Libraries worked with Expression Australia to deliver Level 1 Auslan to 20 library staff. Prior to the Level 1 Auslan training being rolled out, we noticed that deaf customers would come in and often use things like pen and paper to communicate with us rather than being able to converse in Auslan if that was their preferred communication style. So staff now wear badges to visually highlight that they are trained in Auslan. Ipek and I both proudly wear ours, and it's been a really great conversation starter with some of the deaf customers.
I'm involved in the local writability program in Darebin. It is a writing program for disabled people. We participate in writing workshops once a month. I mean, it creates an opportunity for disabled people to express themselves how they want to. It was the first time for me that I'd been with a group of disabled people. I have learned to be more comfortable with myself and proud of myself, I suppose, through doing this program and spending time with the people. Yeah, I think programs like writability are really important.
The important thing to note about the Gorman Award is to explore the options around what you can do for your community. It's about ensuring inclusion, and there's no right or wrong way to do it as long as you use co-design and the concept of nothing about us without us, because you're working towards breaking down the barriers that exist for people with disability, breaking down ableism, discrimination and other aspects that prevent people from using these services that should be a supportive and welcoming environment for all.
So we highly recommend library services to look into these amazing opportunities and grants like the Pierre Gorman Award that's out there to fund their training.
Definitely, and I also think speaking to people with lived experience of disability is really important.
And, you know, we really believe and try and live by libraries change lives, and we've definitely seen it happen.
Australia is a country of fair go, and everyone should have a fair go, including people with disability. And everyone should have a fair go at accessing your library. By accessing Pierre Gorman Award, you're also on the journey of accessibility, diversity and inclusion for those who really need it. Good luck.
Hi everyone. In the spirit of all things Zoom and online, we have a couple of technological hitches which we are not going to let hold us back. My name's Angela Savage. I am the CEO of Public Libraries Victoria, and it's my pleasure to introduce to you, to join me on the screen right now, Paul Duldig, who is the CEO of State Library Victoria. Paul has a strong history in leading organisational and cultural change at some of the most respected universities in Australia and has a deep personal interest in the arts, music and theatre. Welcome, Paul.
Hi, Angela, and hi, everybody. It's nice to be here.
So, standing in for Maxine, we're going to take a few minutes to talk about the Libraries for Health and Wellbeing Innovation Grants. What prompted the State Library to offer these grants?
Yeah, so look, the focus of the grants is really to prioritise public library health and wellbeing programs to support communities. It's such an important initiative. The aim was to solve existing problems through innovative design of programs, effective delivery, and most importantly, partnership development. So we really believe that building strong partnerships builds strong public libraries, and that also builds strong communities.
And we've already seen that in what Dr. McGowan shared this morning, and I'm excited to present some videos soon to show some of those other partnerships in action. And yes, it's fair to say that, well, just to elaborate a little bit more, that the Libraries for Health and Wellbeing Innovation Grants were focusing on those three broad impact areas that were mentioned earlier, physical health, mental wellbeing and social connection, which are all really important ways to help community members. As I understand, there was a minimum grant value of $20,000 and the grant recipients had to meet the criteria of being innovative, collaborative, inclusive and scalable. And after 3 rounds of grant funding, we ended up collectively delivering close to $1 million to public libraries across the state on behalf of State Library Victoria and Public Libraries Victoria, which is, I believe, where you come back in, Maxine.
Yeah, and hi again, everyone. We're having a few issues this morning, but look, you know, we're flexible, we're innovative, we're getting through. No, but I certainly heard your introduction there, and Angela, as you and Paul know, I was fortunate to be on the interviewing panel for a lot of these grants, and it was certainly well subscribed, if you like. We got a lot of interesting applications for this, but of course, the main considerations for those who were able to receive grants was that they could partner with other like-minded institutions or people in their communities. And of course, terrific example there of with what Rebecca told us before the break. And of course, something else that we wanted to look at was the extent to which they could evaluate their programs. And another thing is potentially how they scale those things up, because it's one thing to say, oh, well, you're getting to a certain group and all the rest of it. But you want to be able to say after a while, if you're really going to get into the prevention business and enabling libraries to be at the centre of this, you want to be able to scale this up so that other libraries who are perhaps smaller or whatever can really benefit from what some of their sister libraries are doing. So it was part of a terrific process, really.
Absolutely. And I know that, it's really clear, as I say, when we see the videos, just how greatly the rural and regional libraries have benefited from the funding and the significant impact it's made on their communities.
That's
so,
right.
Yeah, looking forward to seeing those or sharing those videos.
Yeah, the three of us got to do a fun road show recently, only a couple of months back, where we visited a range of libraries. Went as far north as Echuca, always great to visit. Paul, what did you pick up from that visit?
Yeah, look, I was really excited to just get out of town, to be honest. In fact, so excited. I managed to get a speeding fine, which, a bit unfair. 4 kilometres over the speeding limit. Don't recommend it, but anyway, I was the driver.
I didn't know
and,
that.
So, and I'm a little bit poorer now as a result of that. But we went to started out in Shepparton and talked to the fabulous team there, and then went up to Echuca. And then down through to Bendigo and finished up in Sunbury. So we just got such a really great cross-section of the different library services and the different communities they serve. And this was a follow-up really to a road trip that I planned with Deborah Rosenfeld, which we had to pause because of the floods, which, it was interesting when we saw the results of that in Echuca. So earlier, Deborah and I did a quick round to Glenroy, Ivanhoe and Doncaster. So I've been able to get a pretty good cross-section now of the kind of services that are provided, and the way that what's really impressed me is how, whilst there are a lot of similarities clearly across each of those library services, they also are very tailored to their communities. So if it's a multicultural community, if it's a community with a broad diversity of members of the community, whether it's around economic development, whether it's around literacy, whether it's around community service and inclusion. Really, really interesting to see how well those services dovetail into what those communities are actually looking for. So it's definitely not one size fits all.
Yeah,
and
I agree. There are some very distinctive bespoke offerings. Angela, what struck you?
Look, Maxine, I love a road trip, and I was like Paul, really grateful to get out of town. And the passion, I think, is one of those things that really distinguishes libraries. Their passion for community service is so inspiring, and I feel like I've got the greatest job in the world, because I like to describe myself as the cheer squad for the public library sector, and every visit gives me more things to rave about, to be honest. And I would echo strongly what Paul's saying about how distinctive library offerings are, and how customised, how bespoke, how tailored to the needs of those communities. But I also think there's an increasing recognition of our strength in numbers and the power of a united voice. We see that in our advocacy efforts, and we see it in our statewide campaigns where, libraries getting behind a single kind of brand or look to promote reading for children or reading for adults raises the profile of everyone across the board. And so that's been, I think, a really constructive development. So having a sector that can hold those individualised, very localised programs while still contributing to a statewide series of statewide objectives and profile raising, I think, is a really strong measure of the health of our sector.
Yeah, look, just on that, and I know they gave a terrific presentation at the recent conference as well. But I was struck by going into Bendigo's terrific library there. First of all, you go in there and it's a lively, busy place. In one corner you've got a mums and bubs club, and then there's a talk about a local ecology set of issues, and then upstairs people can be doing some family history or whatever. It was really very interesting to see. But actually, this is the point. I was struck there, Paul, by the extent to which Bendigo's library planning is absolutely integrated with their local government authorities' set of strategic objectives. Do you just want to say a couple of things about that?
Yeah, look, that's very impressive, and I think the way that Mark and the team there have really thought about the I guess, the community development aspects of a library as well, and how that dovetails into the what's needed by the region, by the community they serve, and the way that flows through to their strategic plan, I think is really, really impressive. But I definitely saw that in the other libraries, of course, as you have as well, Maxine, and the work that Jenny's done at Echuca, and really over a decade plus, really just really making sure that there is a fabulous service and a wonderful place there, and feeling the energy in Shepparton, and particularly that really multicultural flavour that Shepparton brings, and the library materials in language, and the very strong connection through to Rumballara, and then the Sunbury library service, again very connected through to the local government. The other thing I'd have to say is we're very excited here at State Library to have a station about to open in 2025, which actually goes to Sunbury and Pakenham, I think it is down south. So we might talk about whether we can actually have a three-way something on the trains, or something in the train station, Sunbury through to State Library Victoria down to.
Hey, that's an idea.
Okay.
I like that.
Yeah.
Yeah. Actually, I'm just thinking as well. I thought you were going to say with the new Melbourne Metro, State Library actually gets naming rights for the stop that's going to be right outside. It'll be it's called Library, isn't it?
Yeah, that's right.
Which is fantastic.
It's called State Library. Yeah. The other thing is that when I was at Echuca, I just Leanne mentioned earlier that fun fact about McDonald's and libraries, and that I'm glad that's being used, because that actually occurred to me early in the morning in Echuca when I was out for a run. I saw the Golden Arches, and I thought, I just wonder how many McDonald's there are compared to libraries, and the fact there are more public libraries than McDonald's, I think, is just awesome.
I know, it's good. It's good. But listen, by the way, I know you were going through the whole itinerary there, and it was everyone, that we saw. They were terrific hosts, and showcased their offerings wonderfully. But look, particular shout out to Jenny in Echuca, because as she said, it's out of the news now. They're still suffering the after effects of the floods there. Excuse me. And I know that, her staff were very affected by what happened there.
Yeah.
Excuse me.
Absolutely.
Angela, just come back to you, because you're about to introduce your segment. Look, remind us, we should go back to our core mission. It's still about books, isn't it? And I know you're a great reader and you're a writer.
Absolutely. And I don't think we've got anything to be embarrassed about when it comes to books. It is what makes libraries unique. What distinguishes us from every other community development organisation, notwithstanding our passion for community development. And it's also, I think, a really important part of what makes us that destigmatising doorway, is people can walk into a library for any number of reasons, more readily and more easily than they might walk into, say, a family violence support service, or a service because they have low literacy and they need assistance with their learning. So the books are kind of this beautiful, welcoming entree. And I was thinking about libraries as a space. We talk about them as a safe space, as a refuge, as a place of learning. And in a way, it's that backdrop of the books that's really enhancing of that space. Even if a person comes into a library who never actually withdraws a book from the shelf, I think there's a real attraction in being in that space, a sense that it is a special space, a space of inclusion, a space of stories, whether those stories are read or told or sung, as we see in Baby Rhyme Time. That, and I think there's some beautiful reflections. I won't preempt anything, Maxine, but there's some beautiful reflections in the videos about the library and what the library stands for that I think are really perfectly on point.
Yeah. Well, look, that's by way of what we three have been doing recently, and it's been a lot of fun. Of course, we continue these discussions through the advisory committee for public libraries that are conducted out of the State Library. But look, Angela, I'm going to go to you now, because I know you're going to lead into a whole other discussion. So basically, the floor is yours.
I am. Although, Paul, did you want to just add one thing before we go to the panel?
Yeah, I would actually. Thank you. Look, I'd just like to, before we hand over to Angela, just add my thanks to the speakers for their presentations, and also for everybody for coming to the session today. It's been really eye-opening to hear firsthand so far about particularly the health challenges in regional and rural communities, and just be reminded and I guess re-energised by the fantastic role that libraries play in supporting the health and well-being of their communities. And absolutely, this can't happen without you guys, and you know your communities best. We here in the State Library, and in partnership with Angela and the Public Libraries Victoria, are here to provide a framework and a platform for you. But we know that it's your efforts that are really making the difference, and we're so incredibly grateful. So thank you so much.
Thank you, Paul, and thanks, Maxine. It's really I'm terribly excited to be here today, as you can probably tell, to celebrate the work that regional and rural libraries do for their communities. As CEO of Public Libraries Victoria, I'm very aware of the complex needs that are specific to country libraries, which is why I'm so proud of what they achieve and how innovative they are. Rural and regional libraries don't have the same level of infrastructure as their metro colleagues. They cover greater geographical distances with limited funds and often on a skeleton staff. And yet their communities rely on them for support in so many different ways. I'm so pleased to be able to show you just how much of an impact local libraries can have on people. The health and wellbeing benefits of public libraries across Victoria is a recent research report, and we're going to provide you with the link to that before the session's out. And this report showed that, and I'm quoting here, across all Victorian public libraries, the annual benefits generated are twice the annual provisioning costs. An extraordinary return on investment. And today we want to show you directly the impact that library funding has. All of the libraries that are joining us today received an innovation grant. We're going to see some great videos about the programs developed, and then we'll have a panel of participants to share their experiences. I'll be doing a bit of Q&A, but there's also time for your questions. So if you think of anything while you're watching, please feel free to start asking in the Q&A box below. All right, let's get started. First up, we have Indigo Shire Libraries. Indigo Shire Libraries are located in Victoria's northeast. They have 4 library branches at Beechworth, Yakandanda, Rutherglen and Chiltern. In a recent statewide library service, Indigo residents said of the library, and I quote, "It's a space for connection and also for solitude. It's a place for inspiration and wonder. Early childhood exposure to the books and the library lays a foundation for future literacy. The library is an invaluable community resource. It provides opportunities not available elsewhere in our town." Indigo Shire Libraries won the innovation grant for their program, No More Dr. Google. It targeted men aged 35 to 55 who are reluctant to go to the doctor. It aimed to provide empowerment and knowledge in relation to health issues and to assist men to initiate, conduct and own conversations about their health and personal issues. Let's look at the video.
What you can tell about a man's hands, their grip strength will tell you how the heart is. You know that 80% of chronic conditions can be prevented by lifestyle changes.
Is there somewhere where you can check out the ability of that particular practitioner?
That you are the driver of your own vehicle. Sarcopenia is when you're losing muscle bulk, and you've all lost muscle bulk because you're all over the age of 35. We know 2 out of 3 men, which is all of you here, will have a skin cancer at some stage in your life. Hopefully what you've learned is that little changes every day make a huge difference.
I thought it was very down to earth, spoke in common language that all blokes understand.
Oh, absolutely wonderful. I'm a 100%er, 4 out of 4. Turned up and wouldn't want to miss one evening.
Anyone who doesn't or who's done these sessions, if they don't think they can get anything out of it, they're lying.
From what I've learnt from the course, has really made a difference to the way I feel.
If you don't look after this thing you live in, then it'll let you down too.
Yes, I'm on a dry July at the moment. We've discovered alcohol-free beers, and I don't think we'll be going back to the alcoholic drinks.
I've actually changed a lot. I have been doing exercise programs, but I've incorporated it and taken it more serious. And I have changed my diet. I'm on the 16-8 program.
Yeah, absolutely. There was actually a lot of information I got out of it, especially with the weight stuff and water and just lots of things that, I think we all know but don't really practice. So yeah, no, lots of good stuff. Yeah, I grew up using libraries all the time, and to be honest, I haven't done it for the longest time. I've started using audiobooks thanks to these talks. So yeah.
This library here specifically, they just do so much for us, and I can say that the staff behind the counter just absolutely wonderful. We're blessed here in Yakamanda.
How great is it to see guys in that demographic, men aged 35 to 55, enjoying the library like that? Their enthusiasm for this project was palpable. And I don't know about you, but there's a frisson for me in seeing men talking about taking care of their health instead of complaining about it. And I love that Ruben's saying, he'd started using audiobooks as a result of the program. That ongoing engagement with the libraries is a really terrific outcome. So congratulations to Indigo, and I'm looking forward to talking with you more about that project. But for now, let's hear from Moorabool Libraries. Moorabool Libraries has locations in Balan, Lerderderg and Bacchus Marsh, as well as an outreach mobile library. The Moorabool community has described the library service as, quote, the gateway to the larger community. They provide a place where people and their families can connect with resources, learn new skills and meet new people. Moorabool received the Innovation Grant to start a series of programs under the banner Community Connector. It aimed to partner with local organisations and council departments to support those dealing with social and or physical isolation, including those in older age brackets. Here's their video.
The Community Connector program began because we were really noticing the negative impacts of COVID-19 upon the community. COVID prevented a lot of people being able to connect with one of the few social outlets they have, which is the library.
I heard about the program from the library here in Bacchus Marsh. From there I saw the very first session, which was watercolour painting, and I thought, well, that's a really good one, I would like to do it. So she had a really good instructress come, and all of the materials were set out for us. Everything was supplied, and that was just wonderful.
I just love craft, so that was my thing, because I did the craft things. And meeting people, getting out. I live on my own, so getting out and being away from being on your own. It's just the social side and sharing, learning, being in the community. That's important.
Being able to show people that libraries are more than just books, whether you use it as your lounge and relax, or whether you use it to learn something, or whether you use it to share love of books. And where else can you have people of all ages, all abilities and all backgrounds come together?
It meant that I could continue with my interests. I shared them with friends who were also into watercolour painting, but also it was really good because I live by myself and I can do that at home and amuse myself, and also because it's close and handy. It's in the town here.
To be able to offer it within a library setting, that it's already a safe space, it just seemed to be such a good fit.
I think it's a central point in the town, and people just come here to meet, and it's easy to find.
Having this funding for this community connector role enabled our library services team to see the links between different parts of the community and enable people that are looking for something to actually connect with perhaps like-minded people or an organisation that they weren't aware of, offering watercolour or crochet or ukulele playing or junk journaling. I think that's what libraries are really good at, providing someone with an opportunity to try or find out something. I see it as funding for the hope for the future.
Well, the library funding really matters because it adds things that I can do. It's great for the wellbeing to feel that when you're retired you can still have a very interesting life.
I love that idea about the library as the lounge where you can relax or learn or read, whatever you feel like. I was also struck by the number of times people in that video mentioned the library as both a safe and essential space. And Simone's idea of the library as providing people with the opportunity to try or find out something is spot on. It's the gateway to new experiences as well as to the larger community. Thanks for that, Morrible. And finally, we have Yarriambiack Libraries. Yarriambiack has 7 community libraries across the Shire and 5 drop-off points where people can access reserves via a locker system. They also have a very popular library van. A member of the Yarriambiack community described the library this way. Our library is pretty good for a rural area, but our librarians are next level amazing, regularly going above and beyond to reach and provide whatever service each community member needs. Yarriambiack was awarded the Innovation Grant for their program, Words on Wheels, but were able to extend it, I think no pun intended, to include a book club and mural at a local school designed to engage young people with the library. Let's look at what Yarriambiack did with their grant funding.
The Words on Wheels program began with an idea that it would be a wonderful opportunity to have a bright coloured bike that we would take out to the communities, like our local shows or when we're having activities in the library or the field days in our shire. We thought this bike would bring connection to the community, bringing stimulation into lonely lives.
I heard about the Words on Wheels program through Matoa Neighbourhood House, and the Christmas function featured Santa arriving on his bike.
Trish, Penny and Justin North, they got in touch with me to see if we'd be interested in an art mural project.
The program led me to express myself in a creative way, since I can't really express myself in any other way.
It was a new opportunity to do something cool for my community and make new friends.
It helped me socialise with others that I rarely talk to.
I came to Trish with an idea of running a book club. She just said, that's a great idea, leave it with me, and it's up and running.
Today, especially when so many things are online and through digital media, to be able to go to a library and handle a book and share those books with people is essential.
We live in a rural area where we are all isolated, from young babies through to the elderly. There's lots of people that are living on their own and that don't have internet service, perhaps even financial strain. Due to the Health and Wellbeing Grant, we've been able to reach and engage with so many different ages across our shire. The organisations we partnered with, they're experts in these areas that we are not, so it allowed us to offer many courses and programs that was such a benefit to our community.
I think it's good for people's mental health and it doesn't cost them anything. Some people can't afford to belong to things.
I think after COVID, just to be together and celebrate something happy
I think health and wellbeing in a library setting and in a community setting is an outlet for the students. And if they've got the same interests, well, they'll make connections and feel connected to the community.
Funding is an important part of having the service. If we don't have this sort of service in a town like Minyip, then basically people will just stay home. So I'd really like somebody to pull their finger out and increase the funding.
Library funding matters because it gives kids like me an opportunity to do new things in the community and a great place to make new friends and memories.
It's really clear from this video just how much members of the community value opportunities to come together at the library. It's perhaps not surprising given limited access to the internet in a lot of these further flung places. It's really clear that the relationships that are facilitated by that coming together. I love Karen saying to be able to go to the library, handle a book and share that reading experience with others is essential. Wonderful videos all around. I'm really looking forward to taking a deep dive and talking with the people behind them. So I'm going to invite now into the room, the virtual room, for the panel discussion, Dr. Rebecca McGowan from earlier in our webinar, and joining her to represent Indigo Shires, Lauren Kelly and Penelope McGuffick. Welcome to the three of you. From Moorabool, we have the star of the video, Simone Barry. And from Yarriambiack, we have Sarah Collins. Thanks so much, all of you, for joining us. First up, I noticed that in the results of the library users survey and census that we conducted in 2022, your libraries consistently scored higher than the state average when it comes to the importance of the library for the community, for connecting people with their community, and for supporting their mental health. Why do you think that's the case? And I might start with Indigo.
I think, and probably all of the small rural libraries will be able to relate to this, that because we're a small team with a small population, we know everybody. You know, we talk to them. We talk to them about what they're reading, but we also talk to them about their families and their health, and we sometimes get way too much information. But we've created that connection in our communities. It's you know, it's why we do what we do.
There's a real intimacy to that connection. Penelope, would you agree with that?
I would, and I also think that because of the maybe lack of other community facilities in our towns, the library is a trusted place, and it is really seen as a community centre as well as a library.
Interesting. Is that the same in Yarriambiack, Sarah?
Yeah, absolutely. And definitely when we've got the communities that don't have that physical library space as well, having the drop-off location to still be able to get books to those areas of our community that are sort of a bit more socially isolated, you just see the impact of that just goes above and beyond.
I guess that explains the popularity of your van as well. That just seeing that appear in towns where there's not a lot of services would be, I reckon, uplifting, especially with those beautiful colours. It's such a bright. And what about Simone? What about for Moorabool? How do you account for the centrality of the library or the importance of the library in those factors?
Well, basically, yeah, because Moorabool Shire is a large shire, and because we have two, major towns, I suppose, with Ballan and Bacchus Marsh, getting out to those further reaches, this program, we were able to have that extra funding to reach out that bit further, but also to connect the people that are just as isolated, even though they're living in a town. So it was really vital. But that connection for us is, as people have said, that conversation and the information that you sometimes get, which is too much, but I probably share too much as well. So no, that's a joke. So for us, it's just been so important to be able to show that extra level of of connectability between shire departments and also just with linking people with other people. It's been fantastic.
And Rebecca, did you want to add anything to that about your sense of why the library is so important in these communities?
It's a great question, and I want to talk about the subject of loneliness. There has been some real recent studies done that have demonstrated that up to 40% of men or over feel lonely and actually have loneliness in their life. And a recent medical study has shown that loneliness is the equivalent as an independent factor for causing heart disease. It's equivalent to smoking 15 cigarettes a day. So the libraries really have that purpose of social connection. And the other thing, we may talk about it, which is mental health. In rural areas in particular, men over the age of 75 are at really high risk of suicide, of taking their own lives. So loneliness is that real critical factor that I think that libraries can really help with. And that's where, coming back to this, libraries do change lives with that sense of social connection.
And I think that's a great point. And it was very clear from the number of people in the videos who spoke about living alone. And I took down the quote from one woman in Moorabool saying that coming to the library was being away from being on your own, which I thought was really interesting. Obviously, there are people who also love the solitude of the library, because that came through as well in the research. But I know that we talk about being alone together. It's very different being alone in a crowd than it is from being alone at home. And I know this is an area that that SLV and PLV are keen to pursue and look more deeply at the role of libraries in addressing loneliness. But I wanted to ask you, because the programs that you funded with these innovation grants are so diverse, and I'm curious to know how you gained the insights into community needs in order to design the projects. And I'm going to start with Yarriambiack, because I'm really intrigued, Sarah, at how you got from a Words on Wheels bicycle to a school mural. Tell us about that.
Yeah, absolutely. It's easy for me to say that we just ask people, how do you actually want us to spend this money? But the team already knew. You know, everyone's been saying that we know all our members individually, and the power of being able to use someone's name as they walk through the door. We already knew that, the social barrier of connecting with a library was going to be achieved when we had a bright yellow bike rolling into town with Santa driving it. But we also knew that the size of our shire meant that we couldn't just do one event. We knew that we had to reach out to everyone and be quite proactive. So whether it's with the wee ones with a mobile zoo where people got to touch and be quite tactile with their learning, the mural that you guys got to see on the video was a really amazing way to interact with the local high school as well, and just hearing how much that meant for the kids to meet someone new with a common interest as well. And then the book club, it's this, social well-being that we're sort of replicating over and over with the members, again, that you saw in the video, and how much that means to get out the house and have a purpose to show up and do a little bit of research before, read the book, and, have that interaction with everyone.
Is the book club still going, Sarah?
It is. It's going strong. We also have 2 new members joining us, bringing us up to 8 people.
That's fantastic. Well done. What about Moorabool, Simone? There were some stats at the beginning of your presentation about isolation. So tell us a little bit about your needs analysis. How did that inform what you did?
Yeah, that's right. I mean, it was certainly a core thing. That how did we encourage people to see the library as a safe space and re-engage, but also for those that have never really been into the library, and how we could show them the benefits of social inclusion and how welcoming a library can be, that it's not just about books. So exploring that with my colleagues, and also speaking with one of the other departments that were really focusing on the health and wellbeing of the entire shire, it was really obvious that we needed to provide or promote activities that didn't make people feel sort of like imposed upon, I suppose. It was like, hey, what about if you try this? So the creative craft connections at your library was the way we sort of felt that, well, art often brings people together, or craft. And even just being busy with your hands or learning a skill, you're actually finding out, do I really like it? So even though that sounds really simple, it actually reached a lot of people and then led to other connections which have enabled us to keep going even though the funding has ended.
That makes perfect sense to me. I think what you said in the video about, the library being the safe space to try something new, and a totally non-judgmental space. It's not like you're enrolling in a course that you have to pass, or, and I think that's what's so freeing about it, and something that we can really offer uniquely. Penelope and Lauren, what about, so you've worked in partnership, and really it's a question for the three of you. You've been working in partnership. Dr. Rebecca, it's quite clear that, you've got a really strong handle on some of the health challenges facing rural communities in general and men in particular. What was the link with the libraries? Where were you two, Lauren and Penelope, what kind of inspired you to enter into this partnership in terms of knowing your community?
Well, for me, I was tapped on the shoulder in 2015 by some men in Beechworth. And Beechworth back then, 2015, there was a saying for men, when they turned 40, they either shot themselves or they shot through. And there had been a spate of suicides, and the town was reeling. So a group of local men got together, and we started these programs in the pubs, and we really instigated a lot of change in Beechworth. And then we scaled it up to local areas and programs in Melbourne and Sydney, corporate men's sheds. So Indigo Shire, and particularly in Beechworth, this program was quite well known. So we already could prove that we could deliver programs to men, and we could prove that we could instigate change. So I'll hand it over to Lauren and Penelope to take it from there.
Yeah, thank you, Dr. Rebecca McGowan. And I think we knew the health statistics of our area, but also we know our audience and our social media statistics where men are very underrepresented in our library audience. So it was critical for us to be able to partner with an organisation that already had links with that specific part of the community, and a key objective was to be able to bring that audience into the library so that we could create ongoing relationships with that audience.
Fantastic.
No, I'll add to that we were actually pretty sneaky. Rebecca came up with obviously possibly something that they'd done in the past with their Prick and a Pint program. The idea that we appointed like captains. We sourced people in the community who were like CFA captains or footy presidents or, prominent business owners, and used them as our in. So we kind of used them to do the encouraging for us. That's how we got that demographic in. It was a really, because it would be challenging for us because we know that 65% of our borrowers are women.
And 85% of our workforce as well. So yes, it's I think that's I think that kind of peer referral is a genius move, and I'm sure there are other libraries library reps watching today who are thinking, oh, that's a good idea. And I do want to talk about partnerships. I'm just conscious of time, because I did also want to ask particularly about budget. I know your program budgets are really stretched in rural libraries, and I remember one recipient of the innovation grant saying that the grant was worth more than twice their annual programming budget. So I'm curious as to were there things that had to give in order for you to implement these projects, like things you had to do less of or put on hold? And by the flip side, are you concerned about like having raised expectations and, you know, how to sustain those kinds of outcomes? Simone, I might go to you first.
Yeah, I was just thinking about that because I'd read the question. Yeah, we were fortunate because the grant actually enabled the establishment of the community connector role, which I was fortunate to fill. And that enabled us to basically, I suppose, provide an extra layer of these programs. So in a way, I mean, we had the money thanks to the funding, but yeah, it's a bit like, you know, when you make a cake and you put the icing on. We were able to, for a year, provide a cake with icing, and now we're sort of back to the cake with no icing. But the programs we've already got and the ones that we established were minimal cost. We've got those you know, like we've got the watercolour paints. If we want to run another watercolour workshop, we haven't got much outlay really other than the programmer to run it. So in a sense, I hope that what we instilled with the Community Connector program was that we set some things at the base that we can reach into and actually draw from when we can see that that's going to be just the right thing to do. So hopefully we've got a good layer of the lemon meringue pie. You know what I mean?
And look, I imagine too that if you're working in partnerships with other organisations where you've got the partner coming in to showcase what's possible, and then you refer people out to where they can keep that going in other organisations.
Yeah, and we're collaborating. Yeah, and we're collaborating with the local aged care facility. We're going to be running something, and that is just built because of connecting with them and reaching out and trying to sustain, you know, older residents that still love libraries, and also working with the health organisation that is in Balan, particularly running a health, you know, wellness is goodness program, another collaboration. So I feel that we're off to a good, you know, good start.
Sarah, how about you at Yarriambiack? How does the budgeting and the sustainability questions work there?
Yeah, absolutely. I think I sort of mirror quite a lot of what Simone was just saying there, where we too found that was a huge funding increase to what we're able to deliver, which is almost a double-edged sword. It's amazing we were able to offer this to the community, but you know, when funding runs out, we want to still be able to continue to provide these sorts of things to community. So we found that collaboration was the key to success. So it was working with local men's sheds, neighbourhood houses, play groups, and all these other bodies. So when we aren't able to continue it, we've built the relationship and the understanding of community with these other groups, where this is where they can continue to turn to get support, education, all that social connection as well. So we find that if you give us $1 when you collaborate, you can actually do a $10 outcome, and it really helps actually spread that funding a lot further.
Yeah, I think that's a fantastic approach, and especially as we head into, you know, we know we've got a tight financial or fiscal climate that we're going through at the moment. We didn't see an increase in library funding from the state government at all. We got the status quo, but of course the status quo in real terms means a backward step because there's no indexation. So all of us are probably going to be belt tightening, and I think that model you've described of collaboration gives libraries an affordable way to program while also not competing with your local community, but actually mutually enhancing what each other does, which I think is a fabulous model. And I'll love to hear more about that, Sarah. I'll come when I get to Yarriambiack, we'll have a bit more of a chat. Lauren and Penelope, in terms of what the situation for you at Indigo, that question of budget, sustainability, where are you sitting with all of that in relation to the work that you've done so far?
So this program was made possible with the funding. We would not have been able to run the program without the support from this funding stream. And I echo the sentiment from the other panellists that partnerships are really key in our community, and linking in with other organisations, particularly our community health organisations. And we're just trying to identify ways that we're not duplicating work, but libraries can provide a service to the other organisations where we're a delivery mechanism. So that's where we are at the moment. We've got specific project groups within our team that are focusing on adult programming and trying to be focused on bringing that market into the libraries. And we hope we've received feedback from the community that they would like health initiatives to be run through the library. So it's something that we would like to continue.
Fantastic. Do you know why it is that the library appeals to them as a place for that kind of health session?
I think there's a variety of reasons, but I think just the physical space can't be underestimated, particularly here in winter. It's really warm, it's cozy, it's a safe space. We've got beautiful ambient light. So in our shire, a lot of our facilities are beautiful heritage buildings, but can be a little bit colder or a bit darker. So our libraries that are contemporary offer a really beautiful space. And they're welcoming, people know them, and people feel safe.
That's fantastic, and I think if that all makes perfect sense to me. And the library, the word gateway has come up a few times in the videos and in the conversations. That safe space, that inclusive space, centrality. I think they're all really wonderful reasons why libraries are perfect hosts for that kind of activity. I'm kind of a little bit miffed that I have to open up to audience questions because I'd like to keep chatting with you all. I've got so many more questions. But I think it's only fair that we do give members of the audience a go. And I've got a double-barreled question here, which I might ask the second half first, which is, have you noticed at your library, have you noticed more demand for your services post-COVID? Have you seen a return to pre-COVID numbers, or are you getting a different demographic in the door? Simone, do you want to start in response to that question?
Yes, I'm just wondering whether I'm the best staff member to answer that question. But look, basically, with Balan, we're certainly having an increase in people. It's also meaning that, Balan is growing as a township and everything. So people are coming in and relying on us. The number of people that I suppose that are asking, what programs have you got offered has been really encouraging. For Bacchus Marsh, I wouldn't like to say off the top of my head, but I know we're certainly creeping back up to pre-COVID numbers. And once again, a lot of people moving in, and the first port of call is the library. They're joining up and they're finding out what is available within the community. So I think that's the most vital thing that we're doing post-COVID,
Sarah, what about Yarriambiack? Where's things at in terms of community demand?
Yeah, absolutely. I'm not sure about the more demand, but a change in what that demand is, definitely. So definitely, we're warm, we're open a really stable amount of hours for the community. And it's like, again, reiterating a purpose to leave home, because you can leave home. So it's about breaking the routine of just your own company and then coming into the library. So that demand is definitely a lot higher. We have some people come in, maybe pick a book for 2 minutes, but stay to chat to 45 minutes. Wow. So it's really, really important that our team are able to know everyone by name. And like Lauren said, we know about the kids, we know way more about their family than maybe some of their family knows about themselves. So it's just sort of having that place that they know that they can be a little bit human at that time as well.
Lauren, how about things at Indigo?
I'd say we're probably almost back to pre-COVID numbers, but we're seeing a huge number of people moving to the region from the cities. They're just, it's been amazing to watch how many new families, because I mean, historically, a lot of our towns have been made up of a lot of retirees. So to watch so many families come to our towns now and come in and join the library, it's fantastic.
Yeah.
Brilliant. I'm going to just ask, I've got a question for Rebecca, and I'm kind of smiling on the inside as I ask this, having just helped my Year 12 student study for her Health and Human Development exam. But the question is about specific health issues that are more prevalent or pronounced in rural communities, and you've touched on this. And if there are specific health issues that are more prevalent, what are they and why?
Well, it's a great question, Angela. Thank you. In order to answer that question, I have to explain the big picture, which is, again, we are looking at a reactive, not a proactive. So the biggest health issue is we're still having people waiting until a crisis happens, waiting until they get a heart attack, waiting until they get diabetes, waiting until they get a major health issue before they actually start to take control of their own health. So the clear message is, the health system, there ain't no cavalry coming over the hill, really. So people are still waiting for the magic bullet. There is no magic bullet. The responsibility lies with us. So health literacy is one of the biggest problems, and from that flows on to everything else, which is the increased rates of chronic disease and the increased rates of people dying younger than our urban counterparts.
And isn't that, then that is a great message actually to finish up with, which is that the role that libraries can play in addressing health literacy. It's a perfect kind of partnership role for us, given that literacy is at the core and heart of so much of what we do. I love the idea of the engagement that then leads to a reading list, which can then be made available in the libraries, that people know they can access that reading material electronically if they can't make it into the library. I think this is it's a beautiful example of synergy and partnership. And, like the rest of you, I can only, and I think it was Shane in one of the videos, I can only hope that we see some enlightened responses in terms of funding, because it's an incredible investment, this kind of preventive health and health literacy initiative. Thank you all for being part of the panel today and for sharing your extraordinary projects. Your enthusiasm, your dedication. These are the reasons I love working around librarians and library staff. And it's very clear and I'm sure that the rest of the online audience will agree, that these grants show that with sufficient funding and resourcing, libraries can, as Rebecca said a couple of times, change lives. And with sustained funding, we can sustain that change. How great is it to be able to improve social connection, health literacy, and mental wellbeing of people in our communities?
Yep.
We are privileged to be able to do that. And I'd like to think that libraries are among Victoria's most underrated and overperforming organisations. So congratulations to you all. Again, thank you for being part of today's session. We could talk forever, and I'm sure that I'm going to want to rewatch this session just to pick up on even more. So thanks again, and I'm going to hand back to Maxine.
Angela, thanks. And look, some most interesting comments there. And look, I can only agree. We've all said it this morning, but it's not about being self-congratulatory, but it's acknowledging the breadth and the depth of what our terrific network across the state is doing. So thank you to everyone. I am now going to hand over to Jackie Horwood as the Acting Head of Library Sector Engagement to take us out. But look, just as a final note, I hope you've all found that this seminar has been illuminating and engaging. And I'm very pleased, as I say, about my continuing role on the board of State Library Victoria, because it means that I get to have a front row seat in helping to assess all of the terrific applications that we get, and to get the grant money out to you so that we can see this kind of work. So on that note, it's been lovely to be with you this morning, and I'll invite Jackie now in to formally close today. Thanks, Jackie.
Thank you, Maxine. And thank you to everyone for coming along today. I'd like to express my sincere gratitude to every each and every one of you for joining us today for the Small Libraries Big Impact Seminar. It's heartening to see the support and the love that libraries have in Victoria. We hope that this session has provided you with valuable insights, inspiration and practical strategies to make a significant difference in your communities. The Libraries for Health and Wellbeing statewide public library development project has been so successful, we've extended it for another 3 years. It has produced relevant and timely research, a framework that is taking us forward into the future, and importantly, it's allowed us to connect with libraries all over the state to create new and innovative programs for community members to improve their health and wellbeing, and what an impact those programs have made. Throughout this webinar, we've seen how small libraries can have a tremendous impact serving as vibrant community hubs, improving health and wellbeing in their communities, and empowering individuals of all ages. We have heard remarkable stories of how these stories have transformed lives, bridged gaps, and enhanced and enriched communities, proving that size has no limitation when it comes to making a difference. We want to commend all the dedicated library staff, volunteers, supporters and partners who work tirelessly to ensure that rural and regional libraries thrive. Your commitment, passion and innovative approaches are truly commendable. Your efforts not only bring knowledge and resources to those who need them, but also create spaces that foster inclusivity and creativity and improve health and wellbeing in your communities. As we move forward, let us remember that the impact of small libraries goes beyond the physical boundaries of their walls. By embracing technology, engaging with underserved populations, and forming partnerships within and outside the library community, we can extend our reach and make even greater impacts. We encourage you to take the knowledge and ideas shared today and put them into action, whether it's implementing new programs, strengthening community collaborations, or advocating for the importance of funding small rural and regional libraries, or indeed all libraries across Victoria. Every step you take will contribute to the collective impact we can make together. Finally, I'd like to extend our heartfelt appreciation to our guest speakers who generously shared their expertise and experiences and their support in making our webinar possible. I think you'll agree we have learned so much from the insights and experience of Dr. McGowan. Thank you to Maxine McHugh for doing such a sterling job as MC. You are always such a consummate professional. Thank you to Dr. Angela Savage for helping us to highlight the great work of rural and regional libraries. Thank you to Minister Horn, Leanne Williams and Paul Duldig for your heartfelt input. Thank you to the participating library services. You are all awesome. Finally, big thanks to the Library Sector Engagement Team and JT Productions for all your work pulling this great seminar together. Remember, no matter how small your library may be, it has the potential to create a big impact. Let us continue to nurture and celebrate the incredible power of rural and regional libraries. Thank you once again for joining us, and we look forward to witnessing the transformative journeys that lie ahead for each and every one of you. And I will just mention too that a survey will come out. If you don't mind filling out the survey out, that would be fabulous. Thank you so much and have a wonderful rest of the day.